one of the most important topics I like to go over is fatigue, cancer-related fatigue. So we all know, right? The majority of cancer survivors do experience fatigue. Much of this is attributed to something called cancer-related fatigue. There is category 1 level evidence, that means the highest level of proven research evidence, that exercise is an effective intervention for cancer-related fatigue. And there's that word impairments again. For cancer survivors who have impairments, it's important for them to have a consultation with a rehabilitation specialist sooner rather than later, rather than just being referred to a general exercise class. I try to have cancer patients understand that much like a stroke patient who had a stroke, who doesn't just have to accept the fact that that's the way they're going to be forever, but there is potential for recovery. The same applies also for cancer patients, and the same theory of rehabilitation applies as well too. Cancer-related fatigue, as I said, it can happen from chemotherapy. One of the defining factors is that it's whole body tiredness, just complete exhaustion that's not relieved by rest. You could rest as much as you want and you're still going to feel fatigued. And research has shown that 58 to 100% in various studies of cancer patients receiving various treatments experience cancer-related fatigue. But unfortunately, in and of itself, the cancer-related fatigue is treated less than 5% of the time. And scientific evidence has, again, definitively proven that physical therapy plays a role in treating cancer-related fatigue. Of course, we want to always rule out other causes of fatigue first. Anemia is something that we look at, but very often, when anemia is not an issue, patients still experience and complain of fatigue. And those are very often the patients that we referred to earlier that are not referred on for rehabilitation and exercise therapies. Because those are the patients that they may not feel like they can exercise. They're tired. Why are they going to go exercise more? And the treating physician may not think about it. But again, the studies are there. It shows the best thing to do to get these people is not to tell them to go home and rest and take it easy, but to encourage them, again, remember the American College of Sports Medicine, to avoid inactivity and be as active as possible. How many of you have ever heard of... Don't worry about it. How many of you have ever heard of cancer? Well, actually, chemo brain is really... So, okay, I see a hand up. Excellent. Chemo brain. I see a big hand up now. So, chemo brain. Chemo brain is something that's not well understood, but it is recognized as existing in the world of cancer patients and brain tumor patients. So many cancer survivors, both brain tumor and other cancer survivors as well, report that they have chemo brain, or similar to what we would also refer to as mild cognitive impairment. We've done lots of studies in the past and proven that neurocognitive therapies can help patients who've had a concussion and mild cognitive impairments related to that rehabilitate and improve. And there's growing literature that's showing that chemo brain also can respond to the same neurocognitive therapies as well. Of course, what it tries to assist with is focus on concentration, attention, memory, higher level organizational skills. All of these are important factors which need to be treated. And sometimes it's hard to differentiate between the cognitive side effect of brain tumor versus chemo brain versus both. And that's where a rehabilitation team approach comes into play. And very often a team of specialists, such as a neuropsychologist and or a speech therapist, will help evaluate the patient and really determine where the deficits are and the best way to treat. Yes, Wendy?
Yeah, my question was, are they starting to diagnose people with chemo brain as having a type of brain injury?
That's
some of the characteristics and deficits are the same, but would they be categorized as having a mild brain injury?
That's a really good question. And chemo brain is one of those topics that's beginning to be talked about more and more. So in the world of brain injury medicine, it is being recognized that chemo brain is presenting very similar to what we would call an acquired brain injury and needs to be treated similar to patients with an acquired brain injury. It's not necessarily a traumatic brain injury. However, patients, like I said, who've had any kind of surgery or treatment for a brain tumor, they have both the cognition effects of both the brain tumor as well as the chemotherapy. But someone can have an underlying cancer, not have any therapy at all on a brain tumor, and they can have cognitive side effects from chemo brain. So it is being recognized and treated as a brain injury in the growing literature. And it's something that we try as rehabilitation specialists to be aware of, because very often we will we'll see a patient who will just like say they're in a fog, they can't concentrate, they can't pay attention, they can't follow, they're having a hard time remembering. And if we recognize it as chemo brain, which again is not really well understood, but it's being more and more recognized as a true existing pathology, then we can direct those patients towards the proper evaluation and treatments.
How
Yes.
is it treated?
Excellent question. So by referring a patient with chemo brain to a team of specialists who specialize in cognitive deficits, very often a neuropsychologist or a speech therapist, actually performs a battery of tests to determine exactly what the cognitive deficit is, and then based on that can develop a treatment plan to work with different techniques to remediate, to help compensate for the deficits that you have. So for example, if someone has memory deficits, a very common example would be to use a memory book. That's one very common example. But there's also increasing literature that we know about too that spans the breadth of all rehab, that the brain's ability to repair and regenerate and regrow is much greater than we ever thought that it was. So there's a growing body of evidence that talks about the use of different types of neurocognitive therapies as ways of stimulating the brain to help generate recovery and repair and develop new neural pathways, new circuit ways to help the nerves regenerate and bring the information it needs to bring to other parts of the brain. So again, chemotherapy can cause chemo brain. It's not really well understood, but it does appear to be a real phenomenon in patients who've undergone systemic chemo. Again, they feel fatigued, confused, mentally foggy, but it's not the same as cancer-related fatigue, although both conditions can have fatigue as a major component. But the difference is that in chemo brain, you feel fatigued and you have the cognitive dysfunction. So you're not only fatigued, but you're also in a fog, poor memory, poor concentration. So there is a lot of overlap, and very often patients who have chemo brain also may be suffering from cancer-related fatigue as well. And of course, it's important to fully investigate any treatable cause of cognitive dysfunction. When we say a diagnosis of exclusion in medicine, what we mean is that we exclude any other possible cause that we can treat. And once we rule all of that out, then we can say, okay, by diagnosis of exclusion, it has to be this because it's none of that. So, and again, much like the cancer-related fatigue, bed rest does not improve the symptoms of chemo brain, but oftentimes these patients may have a difficult time sleeping. I always like to mention that on the bottom about if there is a sleep issue to make sure that that's diagnosed and treated, because obstructive sleep apnea with regards to both the cancer and just the general population, sleep apnea causing difficulty with sleeping is a very underdiagnosed and undertreated diagnosis, and it can just as likely affect the cancer and the brain tumor patient population as much as it can affect the non-cancer population. Yeah. It varies on the insurance carrier. It varies on the insurance policy. Commercial insurances are all different, and the rules are always changing with regards even to Medicare. But I could tell you in the patients that I've sent, I had not encountered that as a problem myself. But again, things are changing, and things are going to change even more in October. So things are always evolving and changing. So, but as of this point, no. My hope is actually that as the medical literature becomes more established and recognized, that it won't be a problem. That actually it'll be more accepted. Hopefully.